748 here on WBAL News Radio 1090 and FM 101.5. Phil Yakubuski in for Brian Neiman on this Friday morning. The coronavirus has affected many parts of our economy. We still don't know if and when baseball will be played this summer. And Dr. Anthony Fauci said Thursday, football may not happen. Meanwhile, hospitals have had to cancel elective surgeries, which in part has created a big financial crisis for them. So says Gene Ransom. He's CEO of MedChi, the Maryland State Medical Society. And good morning to you, Gene.
Good morning. How you doing, Phil?
I know you wrote this article for the Baltimore Sun, a commentary about this. How bad is the financial situation when it comes to hospitals here in Maryland?
Well, and I represent physicians, but physicians and hospitals have seen volumes drop significantly. And while they've been very busy preparing you ready for coronavirus, in some cases their volumes and their revenue are down to 20% of what they were prior to coronavirus.
And what does that mean for both physicians and the hospital system?
Well, what it means is that unfortunately physicians and hospitals have had to furlough employees, cut back. They're not bringing in as much money. I have physician groups who've had to lay off employees, and it's a major issue. There has been some help. The CARES Act did provide a loan program through Medicare, and there have been some grant payments through the CARES Act that have helped practices. But like a lot of other businesses, they're struggling very much. And we see that there's a solution here to make things a little better for hospitals and physicians, and that would be simply forgiving loans that were given to physicians and hospitals early in the process through the CARES Act. There was something called the Advanced Loan Program that provided $2.4 billion in loans to doctors and hospitals so they could keep running. And if the government forgave these loans, much like they plan to forgive the PPP loans, this could be a big help to the healthcare system in Maryland and across the country.
Do you think this is going to change the way hospitals do business going forward? I mean, there's been talk about Medicare for all. I mean, I'm sure that's going to be a hot campaign topic as far as the government chipping in with more money for healthcare systems. How does this change things going forward based on what we've been through the past few months?
Well, I think one thing that's going to happen is in Maryland, we're very lucky because we have the unique waiver and hospitals are paid a little differently. So I don't think we're going to have hospitals in Maryland close. I do think in other states, you're going to see some hospitals go under. I think a lot of physician offices across the country and even in Maryland are going to go out of business. So I think there's going to be a major change to the healthcare system. I think a lot of physicians are going to say, I've had enough and just retire. So I do think this is going to put a lot of pressure financially on the entire healthcare market. And that's why we've got to figure out some way that we do things a little differently. I think that on the business side is where you're going to see a lot of changes. And I do think in other parts of the country, there's incredible pressure on some of these small rural hospitals.
Mixed in with all of this, is there still a shortage of physicians, would you say?
Oh, definitely. There's a major shortage, not just of physicians, but all healthcare workers. And I think that's going to put even more pressure on that. If you're an older physician and you're practicing right now, you might say, I've had enough. I don't want to do this. I don't want to work in this environment where I'm going to put myself at risk. So I think there's going to continue to be pressure on the whole community with the shortage. And that's why we think it's really important that while we need to have discussions about big changes in healthcare, we understand that, and we like MedChi wants to be part of that. But we think it's really important that the government do some things in the short run to stabilize the system, like forgiving these loans. We know everybody's hurting, and it just makes sense that healthcare, which is such an important part of the U.S. economy, is stabilized and protected as we move forward.
How confident are you that can happen? Those changes you're recommending?
I think it's going to be difficult. I think it's a hard lift. We're going to push hard right now. One of the members of the House, Dr. Ruppersberger, has signed on from Maryland, and we've got other legislators that we're working on. We're hoping that we can make a change and push things and move it on. Healthcare is a major part of the economy, and it's really important in Maryland. When you think about Johns Hopkins and the University of Maryland Medical System, we're talking about thousands and thousands of Maryland employees. So stabilizing and keeping those people working is really important to the Maryland economy, and it's something we really need to focus on. If those $2.4 billion in loans are forgiven in Maryland, it helps everybody from large institutions that took the money to small physician practices, the small allergist in Howard County who might only employ one or two persons. if they don't have to pay back the Medicare loan that they took to stay operational during this, it's a big difference to the entire state economy, and hopefully the federal government will take this request seriously.
Gene Ransom is president, I should say CEO of MedChi, the Maryland State Medical Society, talking to us this morning about the financial crisis hospitals are facing all because of the coronavirus. Gene, thanks for